Hello everyone, welcome to the second episode of Cancer Talk. लास्ट एपिसोड में हमने देखा कि कैंसर क्या होता है और उसकी भारत में स्थिति क्या है। इस एपिसोड में हम लोग देखेंगे कि व्हाट आर द डिफरेंट टाइप्स ऑफ कैंसर, कैंसर के विभिन्न प्रकार क्या होते हैं और उसमें भी बेस्ड ऑन द जेंडर स्पेसिफिक लाइक मेल्स एंड फीमेल व्हाट आर द डिफरेंट कॉमन टाइप्स ऑफ कैंसर। तो चलो मिलते हैं डॉक्टर संजय से। Hello, Dr. Sanjay. We got some queries like what are the different types of cancers in India? Can you just give some brief idea about it? Okay.
Well, types of cancers, if you ask me, cancers को हम broadly classify करते हैं based on the histology. So it's like carcinomas are one, like squamous cell carcinomas होता है, adenocarcinomas होता है, sarcomas आते हैं. Again, basal cell carcinomas, adenomas. So these are the various types of cancers. But it all depends on where it originates. जैसे कि if you talk about head and neck cancers, squamous cell carcinomas are most common. Now you come to lung, again there is a variety. You get adenocarcinomas and squamous cell carcinomas both. When you talk of breast cancer, again you get adenocarcinomas are the most common cancers. So these are the types of cancers based on the histological features, and it is predominantly based on the area where it affects. So that is about types of cancers where you see how it is preponderance based on the site where it is actually located.
But what are the most common cancers in India? If we say based on the genders like male or female.
Yeah, that's a very good question. See, the most common cancers we discuss now, this is based on the gender base, like what you find most common in males and what you find most common in females. Now if you look at our 2002 WHO data and also ICMR estimates, what you can see is breast cancer has topped the list. Before it was cervical cancer, but now breast cancer has become the most common cancers. After that it is cervical cancer. So almost 25 to 30% of women cancers are breast cancers, followed by cervical cancer. Now look at the counterpart, like in males, it was head and neck cancer before, but now because of the urbanized lifestyle and because of excessive smoking, tobacco and mutations, lung cancer tops the list, and then comes head and neck cancers. So breast cancer, again, if you ask me why it has come top the list when compared to cervical cancer, I'll tell you breast cancer is mostly because of women now adopting to urbanized lifestyle. You know, early menarche, late menopauses, late marriages, and basically don't want to have babies, and they want to focus on their career, which is a very good thing, but also they forget to take care of their health at the right time. There are a lot of screening tests involved which probably they neglect, and then you end up with breast cancers. So if you look at the causes, mostly for breast cancer, it is consumption of alcohol is one, late menopause, early menarche, then you have unexposed exposure to estrogen, use of OCP pills. So these are some of the risk factors for breast cancer. Now if you look at the other second common cancer, that is the cervical cancer, it is more common in rural areas. Now why that is coming in rural areas? Basically it is because of socioeconomic status. Low socioeconomic status is one of the causes for cervical cancer, and also 90 to 85 to 90% of cervical cancers are because of human papillomavirus, that is HPV. So this is infected persons, women have early marriages, maybe when they are just 17 to 18 years of old. So there is a repeated damage to that squamous epithelium. So that squamous epithelium is damaged and there is entry of this human papillomavirus in them. So this remains dormant for years together, and later after 15 to 20 years they manifest as a cervical cancer. Again, a very strong recommendation for screening for cervical cancer has come now. Women more than 30 years of age should definitely get pap smears every 3 years and HPV co-DNA testing every 5 years. So this is mandatory to pick up these cancers early, because you never know when you're infected. Now if you look at the male counterpart, again it's quite simple. Lung being the most common, as I said, and again head and neck cancer. So lung cancer, if you see, it is again because of smoking, alcohol. These are the most common cancer. There is something, the term called field cancerization. Suppose you start smoking and then it is around the lips. So lip cancer, tongue cancer, buccal mucosa, that is cheek mucosa cancers, and you go down throat cancers, and then ultimately you smoke. So all those the infiltrates go and settle in the lung. So again, lung cancer is also most common because those who are smokers. Now in rural areas, head and neck cancers are most common because of tobacco, gutka, charas, what they have, pan, gutka and tobacco. So those are positive agents for